Hi, everyone. I'm Dr. Naya. Raise your hand if you were just at the presentation before this, the 72-hour intake and flow. So most of you, okay, good. How many people have seen Distemper in their shelter and their rescue? So most of you. How many of people seen what you'd consider an outbreak in your shelter or rescue? Okay, well, hopefully we have a lot of good information for you today. So Distemper has been described as the great masquerader because it can cause a lot of symptoms that are nonspecific and can be confused with other diseases, especially in the earlier stages. So it attacks multiple organ systems in the body, and the first symptoms that kind of present are usually, or that are noticed, are respiratory signs. It might be assumed to be kennel cough. Can cause GI signs, vomiting, diarrhea, sometimes bloody diarrhea, and can be assumed to be parvo. And, but the hallmark overall of distemper is that it causes waxing and waning symptoms. So if you have dogs in your rescue or your shelter that are getting sick, seeming to recover, partially get sick again, that's a big red flag that you might have distemper. The disease has a really long time course as well. It has a really long incubation, which is different than a lot of our other diseases that we see in shelters. So usually around 2 weeks, which is a very long time for between becoming infected in the shelter and then showing symptoms 2 weeks later for the first time. But it can be as long as 6 weeks even. And then it runs a really long course through the body. So it can be several weeks, but it can be 3 to 4 months before a dog is recovered and the virus has run through more or less its disease course. And then transmission is, it's very, very easily transmitted in a shelter setting. It can become airborne, especially with coughing, sneezing, respiratory secretions. So neighbors are definitely at risk, but in theory, anyone in the building is at risk if they're inhaling the same air. Direct contact, so co-housing or playgroup, or even if dogs are going nose to nose when one dog is being walked down the line of kennels, or their kennels being cleaned and they're interacting with their neighbor. And then fomite, so it can definitely be transferred via, by staff, volunteers, if people are touching nose to nose and not washing their hands in between. So shedding can actually start before symptoms start, which is really unfortunate. It can, the virus can start shedding 7 days after infection. And so if you remember from the last slide, it can be about 2 weeks before they start showing symptoms, which means that they're starting to shed the disease before they even are showing us that they have the disease. It can, since it attacks most organ systems in the body, all bodily fluids have the potential to spread distemper, but especially respiratory secretions. And then it can shed for as long as 16 weeks, which is a really long time, but usually about 4 to 6 weeks post-recovery is mostly what's reported for how long they shed after they survive. And textbooks also do say that it's estimated that anywhere from 25 to 75% might not even show that they're having symptoms of distemper, and they never show symptoms. So there are a ton of variabilities, a ton of unknowns with distemper in symptoms, in severity, in progression, and in spread or in shedding. Which makes this disease difficult to recognize quickly. It's quite feared in shelters. Some shelters believe, or traditionally shelters have depopulated, which is really unfortunate when they have a distemper outbreak. But at American Pets Alive, we have been giving alternatives to depopulating and focusing on clean break and prevention, which we'll talk about briefly in just a little bit. And we believe these guys are treatable. We do treat quite a bit of cases in Austin. And we can't learn about the disease unless we let these dogs live and see what happens. So at IPA here, we are dedicated to learning more about this disease in order to unmask the great masquerader. It takes this little mask off. Okay. So at APA, we do diagnosis based on symptoms, and we do not test. And we believe that this is the better way to go. I'll get into that in just a couple of slides, but basically there are two categories we put dogs that might have distemper into. The first category is going to be distemper watch. So if they're showing 2 or more of the following symptoms, we'll put them on distemper watch, and we'll treat as signs arise, and we isolate, because this can be distemper, it might not be distemper. We're not quite sure at this point. So usually fever and lethargy is the first symptom that they'll show, but this often goes unnoticed in a shelter setting. But then the next symptom that happens is going to be respiratory signs generally. So generally usually looks like kennel cough, but some of these dogs can have this crust of discharge around their eyes, as you can see in this picture here. So that's a big red flag. If they have a crust around their eyes, that's, at least from what we've seen, it's usually distemper. It's much more likely to be distemper than just kennel cough. Another red flag is going to be this green, copious nasal discharge. And then usually a little bit later on, they'll have pneumonia. So they'll have kind of a soft cough, rapid breathing. They usually feel pretty crummy at this point. A little bit later on in the disease progression, they can get dry eye. So the virus attacks the glands that secrete the watery portion of the tear, and as a result, the surface of the eye or the cornea is really dull, irritated, and what's left is the mucousy portion of the tear, which kind of looks like this boogery secretion on the eye, basically. We've seen a lot of dandruff, so it can attack skin too. So we've seen some of these dogs have just a ton of dandruff, but they can also have pustules, rash, yeasty dermatitis, so hair loss, demodex. They can have a really yeasty smell to them, and we've seen really bad ear infections as well. And then hyperkeratosis, which is essentially thickening of the skin, usually the nose and the paw pads, so it's called hard pad. The paws will look, the paws and the nose kind of look dry and cracked, so that's hyperkeratosis, something else distemper can cause. And then of course GI, so vomit, diarrhea, poor appetite. So once again, distemper watch if they're showing 2 of these symptoms or more. And then we consider a dog to be distemper confirmed if they have neurological signs, which usually preceded the previous symptoms happened previously. So seizures, they can have focal chewing gum seizures. This puppy, the little black puppy in the bottom, is having a chewing gum seizure. Quite literally looks like he's chewing gum, but the seizure is just focal or localized to the face, and they're otherwise conscious. So this is something that can commonly happen with distemper once it progresses to the neurological stage. They can also have grand mal seizures or full-blown seizures. And then myoclonus, or what we call the distemper twitch. Jules, the little brown puppy over here, has this muscle twitch on the top of her head, the temporalis muscles. Can commonly present in this muscle group, but it can present in any. Jewel also has it in her right shoulder. And if you look really closely, you can see that she has a lot of dandruff too. But this symptom, we say, is 99.9% diagnostic of distemper. There are a couple of really rare congenital diseases that I believe Labradors can get that causes this symptom, but if you're seeing this in your shelter, it's probably distemper and not rare congenital diseases. And then finally, since distemper can essentially do whatever it wants in the body, it can cause encephalitis or inflammation in the brain, which presents as kind of a dull mentation, and then blindness. So distemper can affect the retina or the optic nerve, and I've seen a particular case that was blind for about a week, and he seemed to recover. Okay, so I promised you I would get into why we don't test. First and foremost, the test is quite expensive. It's about $100 per dog, and we believe that's money better spent on treatment and trying to save these dogs. And in the face of an outbreak at your shelter, we should be probably focusing these resources on isolating and then having your clean break and prevention. And then for us, results don't change treatment or isolation procedures. If a dog is on distemper watch, regardless of what that test result might tell us, we're going to isolate him. We're going to treat as symptoms arise. And same thing if they're distemper confirmed. If they're having the neurological symptoms, then we're very confident that it's distemper. Main types of testing that that are most commonly done in shelters. There are multiple types of tests, but I just put 2 up here. So the PCR test is called an antigen test. So the test itself is detecting viral particles from the sample that you send in, while the serum test is an antibody test. So it tests more or less the immune response that the dog has had previously, either to a vaccination or to previously recently being exposed to distemper. So serum tests are actually not really reliable in shelters because they're not reliable in a recently vaccinated dog. And at your rescue, your shelter, you should be vaccinating on intake. So that kind of rules that out. And then the PCR test, it doesn't have the greatest accuracy. It can have both false positives and false negatives. And we just don't really believe in using a test if we're determining life or death for an animal, we don't believe in using a test that might give us a false positive. So false positives can occur if the dog was recently vaccinated within the last 3 weeks. And once again, if you're at a shelter or rescue, you should be vaccinating on intake. So it's most likely that your dog has had the dogs have had recent vaccinations, and you could potentially have a false positive. And then false positives are negative as well, and negative tests do not rule out distemper. So we've got a picture of Butters up here on the top of the screen. He's a cute little dog that came to us with pneumonia and seizures. So we were incredibly confident that this was distemper, and it was in the middle of a distemper outbreak at our city shelter. He was vaccinated on the 7th, tested about 10 days later, and the test, while it did come back positive, the interpretation at the test, which is highlighted at the bottom, says that it's most likely just due to the vaccine. So not entirely reliable. And then exceptions to when we would test or we would support other shelters or rescues testing is if the rescue that's going to pull this dog requires the test, or if you are going to be transporting these dogs out of the area and you're in the midst of a potential distemper outbreak, we want to make sure we're not spreading distemper to other shelters. Okay, so prevention is the best medicine. The vaccination can actually work a lot faster than traditional vaccinations do. The modified live distemper vaccination can provide significant immunity within 4 hours and nearly full immunity in an adult dog at the 3-day mark. And just a quick side note, proper vaccine handling is essential, so keeping it in the fridge at all times until it's being used, and then mix it just immediately before you give it to the dog. Real quickly, there are a couple of papers that do show the efficacy of the vaccine if given in a shelter-like setting just hours before exposure to distemper. So this particular study, I just put the summary, the highlights on this slide, but dogs, so 4 puppies were vaccinated, and 4 hours later, they were thrown into an environment with dogs that had distemper. They were followed for a full 4 weeks, and none of them showed any symptoms. And then this other paper is actually back from like the 60s, quite a while ago, but 21 puppies were vaccinated and then immediately exposed to distemper dogs, and only 1 of them died of distemper, and this puppy actually had maternal antibodies, so that means that the puppy was not able to mount its own immune response to the vaccine, but it also didn't have sufficient antibodies from mom to protect it from the disease. And then also very interesting from this study, 9 puppies were vaccinated anywhere between 24 to 72 hours after they were exposed to distemper, and all of them died. So it's incredibly important that these vaccines are given at intake or before intake if you can. And then, of course, while these studies do show that these puppies can be protected from distemper after their first vaccination, it's incredibly important to complete the vaccine series to give them full immunity and to ensure they're protected from parvo as well. Okay, so I'm going to move this over to Jordana now. She's going to talk briefly about the 72-hour intake flow protocol for anyone that wasn't at the previous presentation. But we've been to all of these different shelters and many more, and implemented a couple of procedures to help prevent distemper. And Jordana will talk about that.
Okay, so vaccinate immediately. Don't let them into your shelter without vaccinating them. Owner surrenders, do it in the car. If it's an ACO, do it as they're getting off of the truck or even potentially in the field. Strict quarantine for 72 hours after the vaccine. No contact with your general population. Your new intake dogs that have been there less than 72 hours cannot look at your general population dogs. Just don't allow it. They can still leave the shelter to foster or rescue. So they can still leave, but while they're in the shelter, they're in a bubble. And you need to organize intake. So random lottery placement is not sufficient. You need to house your new intakes together. You want to minimize the exposure if they have an undetected disease that you don't know about. And then anything that's sick, immediately remove it from your general population. If you see it sick when it's waiting to come into your shelter, intake it in a different space. It doesn't go into your general intake area. This is traditionally what happens, right? We have dogs in the shelter, we have animal control, they're bringing in dogs. Well, one of these dogs may have distemper. If they're getting placed into any open kennel in your shelter, which is most commonly what happens, that's your spread of disease. So those surrounding dogs are at risk, and that is how outbreaks start. So the random lottery placement is not what we should be doing. We want to do intake by day, or we want to do a snaking protocol. Intake by day, you do Monday's dogs all go into day 1, Tuesday goes into day 2, Wednesday goes into day 3. When Thursday comes around, all of day 1 has to move out. It gets deep cleaned before new dogs can move in. So all in, all out. You're containing undetected disease. You're using PPE in those areas. If you have separate staff, use your separate staff. If you don't, you need to be starting in day 3 because they're the most protected, and then move to your most naive population. The pros to this is it is complete separation, so you truly have your day 1 dogs, they can't breathe on your day 2 dogs. So it's less likely to spread. The cons is you need space for this, and you need the kennels, which most shelters don't have. So if on day 1 you only get 3 dogs, well, the rest of those kennels just have to stay empty for 72 hours, which is tough for most shelters. So clean break, what we're gonna do, the new method to do is gonna be dogs come in, you have Monday, you have Tuesday, you have Wednesday, and then so what happens on Thursday, all those dogs move out, you clean, and then you move your Thursday dogs in, and they just rotate spaces. So each one of those rooms has to have enough space to hold all of those dogs or cats for the day. It's completely separate. This is just one example of a shelter where they have the space to do this. They were literally different buildings, which is perfect, and they had enough space for each day's intake. So the snaking method is what most shelters need to do just due to space. So the goal is to keep the same neighbors. We want to think of it as like a bank teller line. So we're people. When we go to the bank, we get in line. We go to the very first spot, and then people line up behind us. Same thing with these dogs. Monday's dogs goes closest to the exit because that's where the bank teller is, and then they just follow up and line up behind them. Again, it's lots of movement. So every day we say, I'm going to keep going on the animation here. So Monday's dogs all moved out, right? They hit their 72 hours. Those dogs are clear to move into general population. So what happens next is all of these dogs scooch up closer to the exit. So we're all getting closer to the bank teller, right? So it's moving dogs every day. But you're moving a dog, cleaning a kennel, moving a dog, cleaning a kennel. So when you're cleaning an empty kennel, you're not having to clean around a dog. You're not tethering them to the wall. They're just moving into the next clean kennel in front of them. Again, if you need to keep them longer than 72 hours, that's okay. They can never leave early, but they can stay longer if they need to. This is one example of an intake area. So the dogs are snaking through the top part of the map, and then they exit through into general population when their 72 hours is hit. So prevention is the best thing you can do. And the reason that we emphasize on this is because you don't want to wait until you have distemper in your shelter. You have disease, you have death, and then you have community outrage. So prevent all of those things from happening and be proactive. It just takes one dog to come into your shelter and potentially create an outbreak. So be proactive, especially if you're in the southern states. We know it's in Texas. So we really want the shelters around us and the states around us to just be very mindful about this.
So I was going to quickly talk about two things during that I thought might be helpful to just understand a little bit about, a little bit more. So we're putting the dogs in the snake or in the 3-day hold, and we haven't talked about what's happened to the rest of the shelter during an outbreak. We're not depopulating like we talked about. We're trying to put everybody that has been, we're considering every single dog that is in the shelter the day we get there, the day before we start the clean break, to be exposed. So those dogs are now treated as if they probably have got the disease. And so we're not testing them, but we are sending them home with all of the instructions we would give to a positive dog. So keeping them separate, returning to us if they have any questions or see symptoms, making sure they don't go around any other dogs, giving them really, really clear instructions to keep the dogs safe in the community. And we're relying on the 72 hours to protect all those new dogs. They're going to enter the exposed population after 72 hours. And so we're relying on that vaccine, and it has worked really, really well for us to not have new dogs break. When we have a new dog, we've been tracking, it's been much easier at Austin Animal Center because they're right next to, they're in the same community and we have access to their data. So we had dogs, we had an outbreak, and we started the clean break on November 1st? It was somewhere right around November 1st. And then we were watching, so it takes about 4 months for the dogs that are exposed to stop being sick and being returned. And, so we're looking at intake dates. We take all the distemper positive, or the dogs that are suspected of having distemper or sick with distemper in the Austin area. So as dogs were coming into us from the city, we're watching their intake date, and the new ones that were getting sick were all dogs that had entered been in the shelter before November 1st. They had just been adopted a long time ago, or they were part of the older population, or whatever. We had a handful of dogs that came in that entered the city shelter the weekend of Thanksgiving. And for a few weeks, we saw those trickle in, but they were all in that same 48-hour time period. So we know the system worked because it kept it really confined to just 2 days of intake. It didn't spread all over the shelter. So we feel really good about this, and I know it sounds really complicated, but I think it's a really good system to not have to depopulate and kill dogs that may or may not have distemper, and keep your community safe, and start over and not have not continue this mixing bowl of spread of disease that is so common in Texas. And there was one other thing I wrote down that I thought I should, the no public access during 72 hours. We are trying as a movement to get dogs out faster. So I would say instead of no access, to just have a controlled access. So you know for sure that people aren't accidentally taking dogs out, not accidentally, they're doing it on purpose, but taking dogs out and then letting them smell all the dogs up and down the whole row. If you have some control over it, maybe a person stationed in there to prevent more spread of disease. But our purpose during those 72 hours is to keep them like gold, protected from getting distemper. Okay, so treatment. It takes a long time, we already know that. It takes a long time to treat the symptoms. The symptoms can go on a long time. We see dogs that recover very quickly within a few weeks, and then they're fine and they don't have any recurring symptoms. We see dogs that are going months with symptoms, and typically it's about 4 months, and then you're out of the woods. We don't have, it's not necessarily a protocol for treatment. We're treating whatever symptom comes up. So that you see dandruff or you see a yeast infection in the skin, you treat that. And The only thing that's sort of systematized is antibiotics for pneumonia. We do see pneumonia in the really terrible upper respiratory. It almost always spreads to pneumonia. So we are sort of trying to get ahead of that before they're coming in blue and can't breathe and need to be on IV antibiotics and oxygen. So treating all new symptoms, we give dogs lots of time to recover. We know this takes a long time. We know it's a sneaky virus and it's going to show back up when we least expect it. We want dogs to get supportive care. Basically, it's all about recovery in those 4 to 5 months post-disease. No surgery. We're not going to do spay or neuter. We're not going to put them through any kind of huge stressor. They can move from one house to another, but we want that to be a stress-free move. So we want that to, we will allow it because it opens up a foster home to take in another distemper dog, but we want it to be as stress-free as possible. We have a distemper ward at our shelter, but we really don't want to use it. We want them to be in foster because they get so much better care and there's so much more attention given to them. They really need that TLC. This disease really drags them down emotionally. And we don't ever use high-dose steroids. There has been a lot of talk in literature for eons, decades, about using steroids to try to treat this disease, and we need to be very, 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 very careful about it. We've just recently started using low-dose steroids to treat what we think is a terrible inflammation in the lungs along with pneumonia, but I would try to stay away from the prednisone and dexamethasone as much as possible because it can lower the immune system, which makes distemper very happy, and we don't want that. Okay. So this is one of the breakthroughs that we've seen this year is using IV vitamin C. This has been amazing for us. It's been a total game changer. It is expensive, it's hard to use, it's a real pain in the neck, but I think if there's a way we could figure out how to use this in a more efficient way, it would probably prevent us from ever having an outbreak in Texas again. So you can see the dosage up there. The dose is mixed with sodium chloride fluids, and then it's given IV over 30 minutes. It is a specific type of vitamin C. Vitamin C is really cheap in injectable form, but it's not that one. It is a vitamin C that has no preservatives, and it has to be specially formulated at a pharmacy. And so it is, like I said, it's pretty expensive. But if you give the other vitamin C IV, it could be incredibly detrimental and maybe kill the dog. So that's really, really, really important to know. This should be under the guidance of a veterinarian. So what we saw with Austin Animal Center is we had all these dogs breaking with distemper, and we get to take them all because that's our role in the Austin community. And so we were completely overloaded, and we were drowning in distemper dogs. And it didn't seem, they have 400, 500 dogs on campus, and they were coming from the rabies quarantine, they were coming from ISO, they were coming from general population, they were coming from intake. So basically we knew distemper was all over the entire facility. And so we wanted to try something to see if maybe we could get ahead of it. We know we're not going to advocate for depopulating. We know we're not going to get rid of the exposed dogs. So we went in, and Dr. Naya and Jordana and a few people went in and spent days just administering 1 dose of vitamin C IV to every single dog that they could get their hands on campus. It ended up being 92 dogs that had come in before the clean break. They were still there. A lot of them had gone to foster. We couldn't track those dogs down. We couldn't track the adopted dogs down. We just didn't have time to do those. The ones that had been in the shelter a really long time and were not sick, we did not bother giving them vitamin C because we assumed that the reason they're not sick is because they have good immunity. And I think, let me see if it's on this next slide. Yes. So we treated actually 109 dogs that were exposed, and they had all been taken into the shelter within the last 3 months, and the only criteria for being considered exposed was being on campus and had coming in during the outbreak. The dogs which was the previous 3 months, the outbreak started in August. Some of the dogs appeared healthy and received it. The dogs that appeared healthy and got it never got sick. 2 of the 30 dogs who were already sick with respiratory symptoms got sicker, but none died. So 2, and I fostered one of them, and he had a head twitch and an arm twitch, and that's it. And so he was actually not terribly afflicted, even though he did have some neuro, and the other one never had anything neurologically go wrong with him. He just got pneumonia and was pretty not feeling good for a while. So that's pretty amazing. It's not scientific, it's nothing we could publish. We weren't testing all the dogs. We weren't, we have no idea if they actually were sick, but we assume because it was everywhere that most of those dogs probably were exposed. Some other treatment options that we can offer for early treatment is this Newcastle virus serum. It is a chicken vaccine. It's really similar in structure to the distemper virus. And so the theory is that you give it to a dog, the dog mounts an immune response to the chicken vaccine, and that it mistakes distemper for that new virus that it's trying to fight off, and so it might provide better immunity against distemper. Because you've already vaccinated them, there's not more vaccine that you can give them for distemper, but this may provide a secondary immune response. We make it ourselves. We order it through a farm supply place, and then make it by giving an injection to our dogs, our big dogs that are healthy, and then I think it's 12 hours later we have to collect enough blood to make serum, and then we use the serum to give to the dogs and give it sub-Q. We don't know if it works. We get some positive. I know Jay is here. We used a ton of it in Houston. Sometimes it felt like it worked, and sometimes it's like, well, that didn't help at all. So I don't have a good sense. And I hear that there is a study on it, maybe through Maddie's son told me that. Do you know, Dr. Levy, if there's a study at all from 2014? I've never heard of it, but I don't think it showed anything either. So it's everybody wants to do something for these dogs to help them, and so I would never say take something off the table because it might work, but I don't know that it's something I'd advocate spending a ton of money on because I don't know if it works. It is difficult to find. There is a clinic, Westheimer Vet Clinic in Houston. They gave us a ton of it. We were picking up huge amounts every day, it seemed like, and apparently he has a huge base of supporters that will bring their dogs in and let him give the vaccine to, and then he makes the serum, and then he's able to sell it at a really low cost to rescue groups and shelters. So once sick, so that's kind of before they're super sick, all those things. Once they're sick, we also do IV vitamin C, and the thought process came from just Googling last-ditch efforts for distemper, and there was some, I don't even know if it was a study, I think it was an anecdotal report back in the 70s maybe, where they were giving this to distemper dogs and claiming that it cured them immediately. We don't see that. We don't see 100% resolution by giving this, but we do believe it helps them. It is a huge boost to the immune system. We know we think by taking airborne and some of those other things for humans that we're seeing some ability to fight off viruses. And so we've been going through this whole process of giving this large amount of vitamin C to dogs that are sick. And the reason we got to that one dose of vitamin C is because of our parvo ward. We had a concurrent infection with distemper in the parvo ward, and we were never able to clean it out, get all the dogs out long enough for the virus to die during the hurricane. So in Austin, we were giving every parvo dog IV vitamin C, and the dogs that got it never broke with distemper. The dogs that didn't get it did break with distemper. So we know there's something there. We don't really know exactly what it is, but that's more at the preventative stage, not at the full-blown treatment stage. Okay, pneumonia. Moving on to pneumonia. So and I was talking to I guess an internal medicine specialist in Colorado at CSU about the antibiotics that we should be using for really deep tissue lung infections, and he recommended these two, and I think the chloramphenicol. And so we really stick to the first two because they're the easiest and safest drugs to give. We give a very high dose of Baytril, but we have not seen any negative effects from that, and we have tracked some of our dogs. We used to give that high of a dose to our parvo puppies, and we would track them for years, and we don't see any kind of cartilage response. That's always I don't know if there's any vets in the audience, but that's always the worry with high-dose Baytril. We have not seen any of that in all of our adopted post-parvo puppies. we have to give these antibiotics for a really long time. These dogs are really sick. This virus and the resulting bacteria is really deep in the lungs, and it takes a long, long, long time for it to get out. And so when we first started, we were doing 7 days, 10 days, and then those are the dogs that were being rushed in blue, not being able to breathe, and then we were forced to try to use oxygen and, terrible lengths to try to save them. And so now we're just like, forget it. You're going to be on antibiotics for a long time, and it's definitely going to be dead before the bacteria is definitely going to be dead before you're off of these antibiotics. We will use a secondary line of antibiotics, but only when the first 2 aren't working. Lots of nebulizing. We keep nebulizing solution in our fridge ready to go, and it's part of our take-home package for pneumonia. And we do a shout out to the public to ask for nebulizers, and we get hundreds of nebulizers. We give them to our fosters. We show them how to do this. It is a huge lifesaver to be able to pass this to somebody and let them do the care at home and not have to do it all in the hospital. So this is a video. These are my 3 foster dogs, and the reason I wanted to show that is the twitch again. That twitch means distemper. It is uncomfortable for them as they're getting used to it, but the discomfort goes away, and dogs learn, of course, that's no surprise to anybody, they adapt to almost anything, and generally within a week they're not vocalizing, they're not uncomfortable from it anymore, and they do get used to it. The interesting thing is that because these dogs are living, it goes away. Like now we're seeing that 100% of the time it goes away in a couple years. And so keeping them, like the one in the middle, she has contracted, some of her limbs are contracted from the virus, and so I'm keeping her, trying to keep doing PT on her limbs because she's actually going to start trying to use them again and get rid of the twitches that are keeping her more debilitated. The other thing I wanted to show you is them playing. They don't care, like they're fine. I know they're not fine, but we project how we feel about what they look like, but we need to remember that they may not actually be feeling as bad as we think they're feeling. We also, if they are uncomfortable, we will give them medications to help them have more comfort and be able to hopefully get some rest, because it is hard to get used to. Treatment for seizures. We've seen seizures that respond to phenobarbital very easily. We see them that don't. It's kind of the same thing as the pneumonia. We're trying to find the drug that works and that will keep the seizures at bay. We will euthanize if we can't control the seizures. So we will try all the drugs in the world to stop the seizures, but if we can't, we're not going to let a dog seize to death. That's one of the lines that we'll call it for euthanasia. The other thing we found is that distemper dogs, if you have a dog that you start to get a sixth sense of when they're going to be seizing dogs, when you know it's probably that this dog's probably going to have a seizure because it's got a lot of like jerkiness or twitching that is real sudden, then what we've started doing is just getting the meds to them sooner so that they have it at home, and tell them what to do if they have a seizure, so that they're not running to the emergency room and then costing us $5,000 because they went there and needed all these diagnostics and overnight care and everything else. So that is a pro tip. If you have a lot of these dogs, treat everything as early as possible so that they're not costing you a fortune in an emergency situation. Okay, other treatment, it really is just treating whatever you see. One thing that we have found is Demodex pops up a lot in distemper, and it's probably because of their immune system cratering with distemper, and then Demodex has a window and comes in. So now we don't even skin scrape if they've got hair loss we just give them Bravecto because it is that common. It's almost always Demodex. Let's see, and then sleep. This is another area. I don't know if they have some sort of like night terrors, but there's something going on when they're sleeping that can turn into vocalizing all night, and I don't think it's pain related, but we've found that injectable acepromazine works like a charm, and they'll sleep 6-7 hours at a time. If you give the oral ACE, it's not nearly as effective, and other sedatives don't work at all. So that's just another one of those that we learned. Isolation, they must stay away from other dogs. It's contagious to ferrets. It's contagious to wildlife. we need to be responsible. We don't want to be the ones causing the sealed distemper epidemic in California. We don't want to be the ones giving this to anybody else. So it's really important that whoever is helping you through treatment phase is very well educated on what they can and can't do, and that they're taking it really, really seriously to not let these dogs contaminate another dog. We're also doing the clearance ourselves, so they come back in periodically and we'll do a car side exam and say, okay, it's kind of a history taking and then also a visual to make sure that they look like they're completely healthy. We want them to be clear of symptoms for 3 to 4 weeks before we're considering them done with the virus. And, if you don't have time for that, just assume 4 months and just don't let them be around other dogs for 4 months. Okay, support. So this is a hard one. So we want people to help us, but it's also time-consuming to help them help us. And it's a really disconcerting disease. People really have a hard time dealing with it if they haven't seen it before because it is so awful. So try to think of some mechanisms to support them. You might have somebody who's fostered a couple of distemper dogs and they just have been through it a million times and they know what it feels like. Maybe they can be a lifeline or a mentor for other fosters or pre-adopters. And then there's other groups. There's a active distemper Facebook page. I'm not sure I'd send people to one that's not affiliated with your organization because there's all sorts of things on there that then they'll want to ask you questions about which you don't have time to answer. The whole point is to have a mentor that's knowledgeable on what your practices are so that they can be supported. And then try to preempt as many emergencies as possible. That includes educating people on what to watch for and what they might see, but also making sure they have at hand what they need to treat whatever comes up so it's not an emergency. And then thanking them profusely because it's really hard work. So this was our post-Harvey outcomes. These are, again, dogs that aren't tested. We don't know for sure they had distemper, but they all fell in the distemper watch or distemper confirmed categories, or they were directly exposed to dogs that had distemper. So, it's not great. We had 50% that lived and were healthy, 36% died, and 14% were debilitated. And debilitated meaning they had an issue that compromised some normal bodily function. So it might be megaesophagus, it might be that they have a twitch that makes it a little hard for them to walk, but not so much that they didn't have any quality of life. Okay, so final message. The thing that makes me the most crazy about distemper is that not all of us, but I think we're guilty of assuming we can't control it. And so you hear things like, oh, it must be the wildlife strain, or, oh, all the community's bringing all these dogs into us that have distemper. Maybe some of that's true, but we have a lot that we can control before we start saying it's somebody else's fault. So I think that if I can impress anything upon you is to try to control what you can control and prevent this so that 100% you're doing everything that you possibly can do. And then when you get that random wild card dog in, your system should take care of them so it doesn't spread all over the shelter. And if that's working, it's working. It's like what we were able to do with the Austin Animal Center dogs is that we're able to look at the intake date, see when it happened, look at any other dogs that broke during that time. If they're continuing to break week after week, you've still got a big problem that's in your control that you need to fix. So that would be my final message, is focus on what you can do, not on what you can't do.